Welcome back to the Injury Podcast. And today we are actually doing episode number 19. I want to thank everyone who has been following the show, sharing the episodes, and helping us grow this community. Today, we're discussing a topic that I think many people both find fascinating and a little concerning and confusing. Can brain trauma increase your risk of developing Alzheimer's disease later in life? What does the research actually show? What's the difference between Alzheimer's disease, dementia, and CTE? And perhaps most importantly, we're going to be discussing what people can do to help themselves or help prevent or slow the progression of Alzheimer's. What new research is coming about, and where Dr. Helman believes there might be some more hope of helping find a cure for this disease. And I'd like to welcome and introduce Dr. Helman, Josh Helman. Thank you so much for coming on the show. When I read through your bio, you went to Harvard Medical School. You studied at Cambridge. I felt like a total underachiever, but very impressive. And I saw your YouTube. You have a YouTube channel as well. Very impressed. Before we dive in, based upon how did you come into wanting to learn more about and help others understand more about Alzheimer's, helping people find preventative measures and cures? Was it due to a family member that had it? Why don't we go into that a little bit?
Yeah, so first of all, Dr. Craig, thank you so much for having me on your podcast. It's amazing to be here. And it was very personal. So as a teenager, my own grandmother developed Alzheimer's. So it's interesting, I saw not just how it affected my grandmother Eileen, but I saw how it affected my family, specifically my parents' generation. Because they're looking at Grandma Eileen and they're saying, wait, she's got Alzheimer's today. What's going to happen to us in 20 or 30 years? So as a teenager, I internalized that. And what did I do? I actually studied biochemistry. I was one of those nerds. And I was like, you know what? I'm going to study these pathways and treat it like a language and learn this language and then apply it to try to hopefully prevent and reverse Alzheimer's. And what's really cool is many, many decades later, I'm actually using the biochemistry knowledge that I have. I ended up getting 2 degrees in biochemistry.
Wow. Wow. Awesome. So this was like a lifelong mission, something that it touched you personally and you wanted to make a difference and you knew the effects of that. And I think a lot of physicians out there, this is why they become physicians. They've been touched and in the community by a disease or illness, or seeing a family member, and then they want to help find a cure, help other people.
Totally. I remember back at Harvard College that, I enjoyed, theoretical physics classes, but I was like, this is missing the human interaction. And that's why I ended up going, and my father's a physician, so I grew up with it.
Awesome. Okay, so for a lot of the people out there, before we go in deeper, I just want to announce this, a disclaimer. This podcast is for educational purposes only. It is not to be treated as medical advice. This podcast does not constitute a doctor-patient relationship. So please make sure that you are seeking advice from your healthcare provider. If you have any questions or concerns about anything that we're discussing today on the podcast. But okay, so we had to do that for all the lawyers out there. Now, for the people out there that don't understand too much about different types of dementia, what's the difference between Alzheimer's and there's some other common forms of dementia that people suffer with?
Sure, and that's a great question because it turns out that dementia is the umbrella or the blanket term referring to someone who not only loses memory but loses ability to think and to process information, emotional balancing, interacting socially. So that's dementia. That's the broad term. And then within dementia, there are many different types of causes that cause dementia. It turns out in the United States, about 60% or more of dementia cases are from Alzheimer's. But there are many other types of dementia. So one cause of dementia is CTE, which
Right.
I'm sure we'll discuss. But other common ones are things like Lewy body dementia, Parkinson's. There's a whole
Yeah.
slew. Yeah,
And my mother had Lewy bodies, and it is it's devastating. It really
true.
is the effects of it. Okay, so we'll go in a little bit deeper, and I want to also emphasize that my podcast here is called the Injury Podcast, and what we try to do is help injured people or physicians, chiropractors understand a little bit more about injury prevention, and remedies to help people get better. But we're going to go in a little bit more about some of the research out there. Is there any research that you've seen or heard about that sheds light on or suggests that trauma can cause Alzheimer's?
Oh, definitely. There are published studies, one from 3 or 4 years ago, showing that if you have prior head trauma, your risk of developing Alzheimer's later in life are between 1.5 or 2 times. And it depends on the quantity. The more head trauma. So, for example, if you're an NFL quarterback and you're literally your skull is getting slammed all the time, you're at a much higher risk of Alzheimer's than someone who just had a few blows to the head.
Okay. Well, let me ask you this. Can one single concussion possibly cause Alzheimer's?
I don't think just one.
What if it's serious? What if it's something
I
that's
think
unconscious or something like that?
I think it would increase the risk because if you think about what's actually going on when that happens, you've got a soft brain and you've got a nice hard skull, and then in the trauma you've got coup or what we call coup or counter coup. You have compression, not just at the area it's happening, but on the other side of the brain too. And what I find interesting when I study my patients getting PET scans of their brain with neuroquant imaging, I can actually see on the surface of the brain prior traumas that may have happened recently or things that happened decades ago. That is fascinating that the brain can remodel. And but you still see the effects of the trauma. So I would say it's like anything else. You want to avoid, if you can, head trauma. It's not good. And the fact that I can see it on a scan decades later, to me means it's very important. But of course, if I see one versus see seven different prior, again, you're increasing the risk. And I've got to say, these we talk about these diseases like they're monoliths. They're not. This is very confusing. People are allowed to have more than one condition, but even within Alzheimer's, normally you're dealing with between 30 and 200 root causes, and one set of root causes are going to be trauma.
Okay. All right. So, one question I have too is that, and I don't know, then maybe you could shed some light on this, is that typically when I think of Alzheimer's, I think of older people that are diagnosed with it, people over 65. Has there been any studies where people, let's say that were boxers, and they might have that other condition we're going to talk about in a minute, CTE, but that maybe develop Alzheimer's a little earlier than being older? Have you seen that or heard it? Cases like that?
I have seen it, and I've definitely heard of it. I mean, I've taken care of some NFL quarterbacks that where that happened. So anecdotally, I've definitely seen it.
Okay. All right. Now, we spoke about Alzheimer's, so there is another condition that is common with trauma as well, chronic traumatic encephalopathy, right? Can you explain a little bit about the differences between the two? Maybe some of the symptoms change it, some of the symptoms that might be a little bit different, and so people get an understanding. Because I think when people hear Alzheimer's, they think of dementia, or they think of, if somebody has dementia, it's all Alzheimer's.
Right. And so it's interesting historically, so when I went to med school many decades ago, we were basically taught you're not allowed to diagnose Alzheimer's or these other conditions until the patient dies. And then at autopsy, you actually look at the brain tissue under the microscope, and then you can see changes. So for example, with CTE, you see abnormalities, depositions of what we call tau protein, but specifically with CTE, it's more of a patchy pattern around blood vessels, versus you can also see tau, we call it tauopathies. We can also see that with Alzheimer's. So in terms of symptoms, it's all over the place, because for some people with CTE, you might see changes in behavior where they might become impulsive or anxious. Sometimes you'll see memory issues. Sometimes you'll see it all together. So what's exciting to me is, so historically, you basically had to wait until someone passed away, and then you had brain tissue. The exciting thing now is we have studies. We have studies to measure the function of different parts of the brain, including PET scan and functional MRI, that can help us. And we also have blood tests now that can look for certainly early Alzheimer's markers. So the good news is we can now make these diagnoses and not wait until people pass away. Meaning, not only can we make diagnoses, and I'm sure we'll talk about that, we actually have things that we can do about it to cure.
Right. Okay. Awesome. So we're able, with imaging and better technology, we're able to earlier diagnose these conditions. We're able possibly to differentiate, or to be able to treat the patient maybe differently if there's different medications that a patient would be prescribed, or other natural remedies, which we're going to definitely get into.
100%. And what I'm finding exciting is, like, I worked for decades in emergency rooms all around the country, so I'm well familiar with the emergency care of head trauma. And unfortunately, there wasn't a lot that we were doing apart from watching the patient, making sure they didn't have a bleed in their brain, etc. We were not giving cocktails of medications to prevent brain injury. The exciting thing is there's now research showing that there's specific peptides and modalities that can help, so that you can have intervention quickly and not wait. But that's not happening every time. Like yesterday, I saw a patient who was with major head trauma, CTE, etc., and basically he was told to wait, and we'll see you back. And so it was basically, there's nothing we can do. We'll see you back in 6 months. So I think that's one of my most important messages here, is that there's hope, and there are things that you can do right away. If there's someone listening to this or watching this who has had head trauma, and they feel like they're not getting adequate treatment right now, that definitely seek a second or third opinion.
Okay. So I wanted to ask you this, and I know inflammation plays a role in a lot of chronic diseases, even autoimmune diseases, and cancers, I believe, as well. But in terms of Alzheimer's, does chronic inflammation increase the risks, or possibly be a cause? And the inflammation, like for instance, I'm not sure if the inflammation could be coming from a trauma. The inflammation might be coming from maybe possibly diet, maybe possibly another type, maybe smoking or something else. I'm not sure. So with your experience and what you've learned, does inflammation play a part in Alzheimer's?
Definitely. Inflammation is definitely one of the root causes of Alzheimer's. In fact, many of the root causes of Alzheimer's cause inflammation, and that's how the disease progresses. But what's really exciting is for the last couple of years, I've been using an FDA-approved drug for compassionate use that decreases inflammation in the brain. And I'm seeing good results sometimes after just one dose of this medicine, and we're seeing zero serious side effects.
Wow.
So not only is it like a theory, it's like if you block the inflammation, then you can actually improve the outcome.
Okay, amazing. So I think that some people out there, and there might be a common belief that, well, maybe this is all genetics and there's nothing you can do to decrease your risk of getting some of these, getting Alzheimer's or getting it when you're going to get it. But as a chiropractor, where we believe or we practice more holistic, or I should even say we have a holistic perspective and appreciation in the field. How do you look at that in terms of the genetic factor versus the environmental factor in being a big causative agent or accelerator or cause to Alzheimer's?
Yeah, so genetics is definitely one of the causes. What I find fascinating is it's not just one gene we're looking for or that I'm looking for. There are literally hundreds of different genes now that we know can either increase or decrease your risk of getting Alzheimer's, or I believe problems after CTE, after head trauma. So, and what's exciting is based on everyone's unique genetic defects, and guess what? We're all born. No one's perfect.
Right.
Everyone is born with specific mutations. But once I know your specific mutations, then I can design a unique, specific plan, personalized plan just for you based on the specific biochemical pathways that are not working because of these defects. So people may have heard of apolipoprotein E, ApoE4 as being a risk factor. Yes, it is a big genetic risk factor, but what's fascinating is it's not the only one. There's so many others. There's progranulin, there's MAPT, there are literally hundreds. And right now, most physicians are not looking at that with their patients. I am, and I love doing personalized medicine. It's something. It was my dream as a teenager, but now it's not just in a textbook someday. It's like that day is today.
Dr. Helman, what I like about you is that you, on your YouTube channel, you have this hopeful attitude. You give people hope. And I think that for a long time now, many people out there, if they were diagnosed with Alzheimer's, thought it as this is like almost like a death sentence because their own sense of consciousness, who they are as a person, is going to be taken away. And there's a lot of misconceptions which I definitely want to shed some light on, but if we decrease the risk factors, or if people are exposed to those, then what are our chances of maybe having an Alzheimer's, maybe us expressing Alzheimer's later, might be a little later, or put off or slow down? Like, what can we do to help slow down the effects of this disease?
Yeah. So first of all, I've been in this field for like 10 years, and so I've been literally giving people their brains back after seeing them, in a very hopeless situation. Which you're correct. Decades ago, is basically there's nothing we can do. Put your affairs in order. Mm-hmm. So we've gone from that to the last 10 years. I've been helping people get their brain back together and seeing that impact. But your specific question to me was, what are the things that we can do to either prevent and reverse? I would say I would focus on lifestyle, which by that lifestyle I mean making sure you're getting enough sleep, deep sleep, making sure that you're exercising every day, that your diet is low inflammatory diet, that your stress level is low, that you are in a community, that you have friends and family, and that you're socially connected, and that you're not using substances like tobacco and alcohol that do damage to the brain.
Right, right. I think this is great. I had read Sanjay Gupta's book a while back, a few years ago, and I felt that it was great because it shed light on all these different risk factors, even some of them like searing meat or the way you're preparing foods or using certain oils that can have an effect, that might have an effect on accelerating this if you have those genes where you have more of a tendency to get that, then by having a better lifestyle, maybe we could suppress that. So it's okay. So we talked about some risk factors. We've talked about some things we can do. What kind of medications are typically prescribed by most physicians with patients that have Alzheimer's now?
Right. So for a couple decades now, we've had prescription drugs like Aricept and Namenda. Both of those, Aricept increases the amount of acetylcholine in the brain, which acetylcholine is a very important neurotransmitter. And then Namenda is another prescription drug that specifically lowers NMDA in the brain. So what's exciting about these medications is they do seem to, in many cases, slow down the progression of the disease, but they don't reverse it.
Okay.
So that's been for like 20 years. More recently, we have these anti-amyloid antibodies that I'm personally not a fan of because, they do also tend to stop the progression, but in up to a third of the patients, they can get brain bleeds or brain swelling to the point that if you want to take one of these new anti-amyloid antibodies, you're required to get a brain scan every month to catch the brain bleeding and the brain swelling early. And instead of the anti-amyloid antibodies, I've been using an antibody against galectin-3, this inflammatory protein that's higher in patients with head trauma or Alzheimer's.
Okay. What about peptides? A lot of people are talking about peptides right now. Have you seen any research or maybe use even some peptides that you think are helpful?
Certainly. So my favorite peptide to start with, many of my patients have high levels of toxins, and by that I mean things like heavy metals, plastics, pesticides, forever chemicals, mold toxins. And so for those toxins, I will use a peptide called glutathione, which is 3 amino acids. It's the master detoxifier. It's an antioxidant. Another peptide where there's good research out of Europe that I've used and seen good results with is cerebrolysin. It's hard to get in this country, but I am a fan of cerebrolysin. But a lot of it is going to be individualized. So, for example, if I know from your testing or from your genetics that a patient has issues with their mitochondria, I may use a peptide like SS31 that specifically helps regenerate mitochondria. So, what's exciting is the number of peptides available is exploding, and I get to choose and work with my patients. But in the category of peptides, I include exosomes or regenerative, because if you think about what exosomes provide, one of the things they provide is over 500 different peptides that can help regenerate the brain. But I also, in my opinion, it's extremely important to do therapy in the right order. You normally want to remove toxins first before you try to regenerate. It's very difficult for brain cells to regenerate if it's in a soup of lots of toxins and infections, for that matter.
Right. You need fertile soil, right, to grow crop. Let's unpack that because that was very technical. So there's protocols that you use or other functional medicine, I guess, or lifestyle type physicians use to treat this condition. What are exosomes and what are peptides? Just so some people out there, they might not know exactly what they are.
Sure. So let's start with peptides. Peptides are molecules that are just a collection of amino acids. And so the first peptide that was discovered and used clinically is insulin. So if, for example, you're a diabetic and you're, whatever reason, your body can't make insulin, your blood sugar would go too high. And fortunately, we now have the option to give insulin peptide to patients who are diabetic and need it. And frankly, it's been life-saving over the last 100 years. But there are other peptides that are literally snake toxin venoms. So it's not true that all peptides are good.
Right.
You have to select the correct one.
Right.
And you were also asking me about exosomes. So exosomes are like stem cells. I don't know if your viewer. So stem cells are cells that can go on to develop into other tissues within the body.
Are those the stem cells that are like embryonic stem cells, or are those stem cells that are from our fat tissue?
Those are all different types of stem cells. But what's fascinating is from those stem cells, the way they communicate with other cells, it turns out it's through something called exosomes, which are, we used to think decades ago that these were just waste products that were coming out of the cell. But we now know it's not waste products, it's actually peptide signaling molecules that are coming out from these stem cells to communicate to other cells throughout the body. So I've had good luck with exosomes. Exosomes, in addition to the many peptides, it will also have nucleic acids. There's some newer formulations where they get rid of the nucleic acids. But I know this is very technical.
Yeah.
I think the important thing for people to realize is that there are these newer technologies that can allow the brain cells to regenerate, which is what we want.
Yes. So, and many of these are natural, right? They are some of them may be plant-based, or not all of them are derived like synthetic, or a lot of them are synthetic. How the peptides?
I would say they're a mixture. Right?
Mixture of that.
I mean the original insulin was derived from other animals.
Right.
But now that we've gotten much better at manufacturing, there's some peptides that are manufactured in a lab, and so I would say it's a mixture.
It's a mixture. Okay. What therapies excite you? What are you really excited about right now in terms of helping to decrease the effects of Alzheimer's or slow it down?
One thing that I'm finding very exciting is blood purification. Because to be specific, we're using something called TPE, therapeutic plasma exchange. We're actually filtering toxins out of the blood. Another one we're using is called EBU therapy, using ozone to also purify the blood. And the reason this is so exciting to me is often right after one or two of these therapies, people are like, my patients are like, wow, I feel lighter and I can think, my brain fog lifted. So I'm seeing instant feedback that this is, in many cases that it's working.
Wow. So let me ask you this. You're talking about some people feeling better, or feeling their thinking maybe clearer. Somebody that doesn't have Alzheimer's, but somebody that's in their 40s or 50s, that maybe they want to be proactive and they want to do things to help prevent them from getting Alzheimer's in the future. What would you recommend for those kind of people?
Yeah, so the first thing I would do is I would go back to talk about lifestyle. Make sure you're getting enough deep sleep. Make sure you're exercising. Make sure your stress level is low. Make sure you're eating a low inflammatory diet without a lot of processed foods and with more plants. Make sure your stress level is low and that you're part of a community. And then in addition to that, the exciting thing is these blood filtration and some of these other therapies can be used on people before they have Alzheimer's. Specifically, here's one of the fascinating things. It turns out that toxins age us prematurely. So if I can remove these toxins from you or from someone else, I can turn back your biologic age. And I know some people are listening here and say, toxins, what are you talking about? And what I'm saying is, unfortunately, as an example, the amount of plastic in the environment is doubling every 14 years. Right. It's gotten in the food supply. Things like PCBs, DDT that we stopped producing in the 1970s, unfortunately, they're still around. They're still in the food supply. They're still in people. Heavy metals, mold toxins. I've been doing this for 10 years. I'm seeing higher levels of toxins and more toxins in my patients. So the flip side is, if you want to prevent this, you don't have to wait until you actually have brain damage. You can actually, if I can get these toxins out of you, you may think more clearly and buy yourself more time. And that's been popularized recently by Brian Johnson and other biohackers.
Right. So somebody out there that possibly could have had trauma, head trauma, concussions, it might be a good idea to look at things from a perspective of prevention of some of these other conditions that might develop in the future later on. And because of the trauma to the head, we have inflammation just due to the blunt force. So I think that, inflammation could be caused from a variety of different sources, trauma being one of them. And with AI now, and I know it's being used in healthcare quite a bit, but you're a physician you're in this space. What do you think in the next 5 to 10 years in terms of new medications, or work with maybe peptides or other type of medications might come out that might be able to really change this landscape?
It is so exciting because I can't even think 5 or 10 years ahead. That's how quickly things are going. Now, there are dangers. There's dangers that government regulatory may slow some of this down. I've got a patient who's going to Cuba to get a peptide specifically to help with their brain because it's not available in this country. They literally have to go to Cuba to get it.
Wow.
So, but in terms of, I am very optimistic about the future because I can use AI now, study my own patients, and then tease out what seems to be working or not working. But in terms of today, not 5 or 10 years ago, today, literally I have 50 different potential therapies I can use. But understanding which are the right ones, when to do it, I'm so excited that I now have AI tools that can help me figure it out.
Wow, that's amazing. And I've heard that AI can help scientists model, use so many different genes that they can look at and just randomly try so many different experiments, give scientists feedback that in the matter of overnight, which would normally, those experiments to run those models could take years. So they're getting that feedback, and then they could explore those and develop those models that look more promising.
Right, but let me give you a specific example of where we've taken hundreds of patients and tried to model what's the biggest risk factor for developing Alzheimer's. It turns out not getting enough deep N3 sleep is the number one risk factor. So that's come out of with AI research. So that's why for my patients, I'm making sure they have a sleep study, because they may say, oh, I sleep fine. They may sleep fine, but they may never get down to the deep N3 sleep during which the brain is able to clear out the amyloid and consolidate memories.
Wow, that's surprising. I wouldn't think that would be the biggest risk factor. I would think smoking maybe, or maybe some medication that would be a high risk factor that might cause possibly plaquing or something else, a side effect. Well, that's really interesting. What about, are there certain sleep medications that people use? Do they get that deep sleep with those, or is it?
Unfortunately not.
Okay.
Most of the sleep medications Like people might take, well, first of all, I found this figure shocking. 2/3 of American adults take a sleep aid to get to sleep.
Wow.
So that's number one. Number two, if many of these sleep aids, some of these prescription ones, actually they'll get you to sleep like Ativan or Xanax or even Benadryl, which is an antihistamine over the counter. It'll get you to sleep, but you won't. It'll actually destroy your ability to get to the deep sleep. So alcohol is another example. If you drink alcohol, sure, it might put you to sleep, but it will ruin the quality of your deep sleep. So it'll be counterproductive.
Wow. What have been some of the research related to alcohol and Alzheimer's? Is there anything that you know?
Oh, there's definitely a connection between alcohol usage and Alzheimer's, because we know alcohol is a potent neurotoxin in addition to causing cancer.
And it causes inflammation in the body as well.
True.
Great. Okay. All right. So, what therapies that you're looking at now are you excited about and recommending? We talked about peptides, but are there any kind of therapies that people are doing, whether it be like red light therapies or things like that? I don't know. That's what.
Sure. So I'm a fan of red light therapy because that actually optimizes mitochondrial activity, which mitochondrial are part of the cells that produce energy and remove toxins. So I like red light therapy. I also like hyperbaric oxygen therapy. And hyperbaric oxygen, oxygen under pressure is interesting because there's two ways to dose it in terms of how much oxygen and how much pressure you're using. And there are definitely studies showing that hyperbaric oxygen can help with both Alzheimer's and after head trauma. So I'm definitely excited about that.
That's great. And in terms of exercise, we spoke a little bit about that before. What about building muscle or a resistive type exercise? Because I know a lot of people walk, and even when I see patients, a lot of patients will say, well, I exercise, Dr. Selinger, I walk a lot. But it's not the specific exercises I might have recommended for them, but people consider just walking exercise, and it is an exercise, but it's not, it's a type of exercise. What have you heard with some of the research? Does it help doing resistive exercise? How many times a week should people be exercising according to what you've seen?
Yeah, so great question. So it turns out that, well, in the scenario you gave, I'll say, great, you walk, that's good, but I'll ask, are you sweating? I want them to do cardio, and if they're not sweating, they're probably not doing cardio. That's number one. Number two, I like resistive, so often I'll say, how about using a weighted vest while you walk? I mean, every patient's a little bit different. The reason why exercise is so important is we now know that when you exercise, you release a peptide in the brain called BDNF, brain-derived neurotrophic growth factor, and that stimulates the growth of new neurons and new neural connections.
Nice.
So, and that's why I want my patients exercising every single day. I normally talk about 3 different types of exercise. I talk about cardio, get their heart rate up, because if your heart's not working, if it's not delivering oxygen to the brain, you're going to be in trouble. So that's number one. Number two, I want them to be building muscle. And then number 3, I want them to work on balance, because the last thing I want them to do is fall and break a hip and then be out of commission for a year or worse.
That great advice. Great advice. Now, we spoke about alcohol, that should be that can contribute and increase risk factors. What other foods or what other substances? We know, I'm sure tobacco is not good, and vaping and things like that. What other things should people avoid? Because that's really important for people to understand.
Sure, and this might be shocking, but we want to lower inflammation in the body and specifically the brain. So the first thing I ask people to cut out is dairy, milk, cheese, because those when you eat milk or dairy, something with those in it, your body recognizes that is not your cells. That there will be pus, there will be white blood cells in the dairy, in the milk, or the yogurt from an animal source. Your body will recognize, wait, these are white blood cells from cows or sheep or wherever it's from. This is not human. This is not me. I am going to mount an antibody, an immune response against it, which causes increased inflammation throughout the body, including the brain. So the first thing I have people do is cut out dairy. And then the second thing I normally have them do is cut out gluten, because gluten is an inflammatory protein.
Right. Wow. So Italian food's kind of rough then, the cheese and the pasta.
I mean, you can get substitutes. You can,
Right. Yeah. No, I
yeah,
know.
yeah.
I know. It's good to educate patients and people on what they should avoid, because all too often they're consuming this as a staple in their diet all the time, and then maybe they do have a family history of Alzheimer's, and then they do drink it, maybe a little bit more than what they should. So every little bit, I think, could help. What would be some things or foods that they should try to get a lot of? Green vegetables, or what do you recommend?
Totally. I recommend lots of plants, fruits, vegetables, and whole grains, except for wheat or gluten. I recommend those things because they have not only do they have molecules antioxidants that will help with brain health, but they also have fiber. And it turns out that fiber can feed your healthy gut bacteria microbiome, and the average American is not getting enough fiber. And it's fascinating. The fiber gets converted in the gut by the microbiome into these short chain fatty acids, which some of those can actually then go up to the brain and be used as fuel.
Okay.
So there's an amazing connection between the brain and the gut.
Okay. Mediterranean diet, yay or nay?
I would say in general, yay.
Okay.
But with all these diets, it's compared to what?
Right. Well, the American diet, I should
Yeah. Oh
say.
yeah. Oh yeah. Oh yeah. That's much better.
Okay. Excellent. Excellent. In terms of waters, I know, there's people that drink bottled water. There's people that drink tap water. I know there's some toxicities in waters, and it depends where you live, in what country you live, and so forth. Anything to watch out in the water that we're drinking?
Right. So when I'm looking at my patients, I'm seeing lots of petroleum, chemicals, heavy metals, and one of the sources is the drinking water or the water that people shower with. And so unfortunately, I don't recommend drinking tap water or bathing in it in general. I'll give you an example. The last step in most municipal districts for purifying water is to add aluminum. And it turns out because aluminum will get rid of the particulate matter, the leaves and other stuff. But unfortunately, aluminum, we now know, is a neurotoxin. And so the last thing I want people to do is be drinking a metal
Right.
that's a neurotoxin. So to me, the best thing to be drinking or bathing with is either distilled water or reverse osmosis.
Okay. So a couple of other things I want to ask you. Have you ever heard use it or lose it? It's a common phrase a lot of people have heard. What about if people are doing mental exercise and decreasing the risk of Alzheimer's? What are your thoughts on that?
Yeah, I agree with it. Just like if you don't use muscles, they eventually go away. The same thing with our brain. Our brains are designed to be used constantly. I'm not talking about overloading and trying to use your brain 24 hours a day, but it is the case that I want to challenge my patients' brains. So crossword puzzles are okay because I'm asking you to remember words, remember things you already learned. But what's even better is to ask you to learn something new, learn a new musical instrument, a new language, meet a new person, go to a new place. It's the novelty.
Right.
And there are computer games now that also will cause your brain to have to hyper focus and pay attention. So, for example, they may show you a red ball and a blue car, and then for only for a second it disappears, and they say, where was the car?
Right.
Yeah.
And you have to remember, and it
Yeah.
tests, it challenges
It
you.
challenges it, and it forces you to learn to pay attention. I remember when I was in 7th grade, I took one of these Evelyn Wood's reading dynamics where I learned to speed read. And how did they teach us? They had these. This is back in the 70s. They had this contraption where they only let you see the word for like a split second, and it forced your brain like, okay, I need to pay attention. It's the same thing for adults who are trying to preserve or bring back their memory.
Love it. What about, you just mentioned about musical instrument. I know there's left brain, right brain. Is there, if you can only do one, is there more research with doing more left brain activities like math problems and things like that, or more right brain, maybe painting or playing musical instruments or things of the creative genre?
Yeah, so I'd say in general, both are important, but each patient is different. I have some of my patients where their major issue is language. And if you look at their functional studies of their brain, they have got damage or infection or things going on in the left brain, and we need to focus on their left brain. So I like to personalize it, but in general, we want to get the whole brain going. But again, I will just like I'll personalize supplements or treatments to someone's genetics, I will personalize it to their PET scan or other imaging.
Oh, that's amazing. That's amazing. Even or things that require coordination. What about learning to dance or to do this? So we're using our mind and we're using our body it requires coordination. It requires memory. Sports sometimes learning how to play pickleball or to do a certain move, a stroke can also require memory, coordination, and it hits a lot of those different things. Learning how to play.
I love that. I love that because what you're talking about, coordination, that's the cerebellum, which not only works with coordination, also works with memory. So I love that.
Yeah, great. So you are able to assess a patient, evaluate a patient, use advanced imaging studies, and then can custom tailor a treatment program for that patient to help them. Now, if somebody wants to learn more and they want to contact you and they want to become a patient, how can they reach you?
Probably the easiest way is through my website, which is just drjosh.com, drjosh.com. And how else? That would be. I mean, I'm on social media under Green Brains MD, but in terms of reaching me or my staff or one of my clinics, drjosh.com is probably going to be the easiest way.
And where do you practice out of? What area?
Yeah, so it's interesting. I literally see patients all around the world through Zoom, etc. But I have several clinics here. I have one across the street here in Boca. I've got one in downtown West Palm Beach. I've got one in Palm Beach Gardens, and then I also have another one in West Palm Beach. So I'm spread out. But again, I view my biggest goal is to spread the word that there's hope.
Yes.
And but I do love working with people one-on-one, but of course I can't see everyone.
Yeah, you can. And I think that's the most important thing, because sometimes the worst thing a doctor could say to a patient is, I'm sorry, we can't do anything. And sometimes that is the case. Sometimes that's the case. But it's just so refreshing when you meet someone that wants to turn over every stone, leave no stone unturned, and try to find answers and constantly research new ways that might help people live a better life, live a better experience of themselves, and at least maybe push off or delay the effects of Alzheimer's, which is very concerning for a lot of people right now.
And if I could add, it turns out that the research is also showing that people, it takes normally 20 to 30 years for Alzheimer's to develop.
Wow.
But people may only be aware of it the last 10 years.
Okay.
And it's a lot easier to prevent something like Alzheimer's than try to reverse it.
Wow. So, folks, if you have a family history of Alzheimer's, this is very important. And I think everyone should be proactive, take responsibility for their health. I'm a big advocate of that. Do research, live a healthy lifestyle for one, get rid of the toxicity, because you are in charge of your own health. You have to be your own advocate first. And there's good news that we are learning more. We are finding better ways to treat this condition. And do you work with other physicians? So let's say somebody's out there and they have a doctor that they're working with, maybe a neurologist that they're treating with, and it could be in another part of the state or another part of the country, and they want to come here on vacation and maybe meet with you in person. Do you do that?
I do. I do meet with other physicians. I find that there are some physicians who are open to other ideas and some who are extremely closed off. So, but I enjoy spreading this message of hope to both the public and to physicians. It's just, I feel for physicians, my colleagues, because they're busy. Many of them don't have time to learn about these new therapies. They don't have 2 degrees in biochemistry like myself, and can even test and say, oh, this makes sense and this one's
right. Or they're practicing in a different medical model where it's not as individualized. Maybe they have to see 50, 60 people in a day, more or less. They have a lot of hats they're wearing.
Right.
They're dealing with insurance companies and all this different stuff. So sometimes they just don't have the bandwidth or the time to be able to do these other therapies, or they think they might not just know about it.
Right.
But the good news is that we have people like you that are shedding light on these other therapies and these different approaches to treating a condition that is so scary. It's so scary for people. And if anything, I really appreciate today's conversation of what people can do to be proactive, because it takes, people can have Alzheimer's and it be undetected for so long, and then later on, it's only later on when maybe we are experiencing some symptoms and we go and we get all these other advanced imaging studies, and then we find out we've had it. So that's interesting to know.
Right. But you mentioned this is an emotional topic, not just for the patient, but for the families, for the care, for everyone. But what's also embedded within it, so many of my patients have emotional, because of the dementia or the Alzheimer's, they can't regulate their own emotions. Right. So there are a lot of layers to this, and but the exciting thing is we live in a time now when there definitely is hope. There are often, it's like, let's decide which of these many options we can pursue.
Right. It's a lot better than 20, 30 years ago.
No question.
Awesome. Okay. Well, we do have a tradition here on the Injury Podcast. At the end of the podcast, we give a gift to our guests. We have these superhero tumblers. We have Wonder Woman, Thor, Captain America, Hulk, Deadpool. I do have a few other ones. I might have I think I have a Spider-Man one back at the office. And we give this because we feel superhero embodies comeback, resilience, and that's who we are here, and that's what we want our guests to have a memento to symbolize our appreciation for coming on the show. Do any of them speak to you? Oh, I have a Batman one too as well.
I'll tell you what speaks. It's the Hulk, and I'll tell you why. With the story of Bruce Banner and a scientist working in the lab with radioactivity, and then also. Look at these muscles. We talked about the importance of muscles for brain health, and frankly, sometimes I get angry at this whole Alzheimer's disease process, and do everything I can to fight it. So,
Yeah,
so
awesome.
this is an amazing.
Does testosterone actually show that it helps in any way?
It does.
It
So
does.
not just testosterone, but also hormones in general. So it turns out that for my patients who are deficient in testosterone, I will normally figure out a way to supplement so that the brain is working better. Also, estrogen or estradiol in both men and women are key to brain health.
Wow.
We now know.
Dr. Helman, this has been an amazing episode. I really appreciate you coming on the show. There's so many different factors to look at, and I really appreciate you shedding light on this topic for our guest, the risks of trauma, inflammation with Alzheimer's. Thank you very much, sir, for being on.
And Dr. Craig, thanks for including me and including this important message.
Yeah, thank you, sir.
Awesome.
All right. And remember, like, follow, subscribe. See you on the other side.